Welcome to the discussion on cerebral palsy.
Welcome to a story that begins deep within the human brain. Inside these walls, every diagnosis tells a story.
Cerebral palsy is a lifelong problem that affects how a person moves or keeps their body upright.
It happens because something went wrong in the brain when it was still growing. Kalinas, before, during, or shortly after birth.
The motor cortex controls voluntary movement, the cerebellum manages balance, and the basal ganglia smooths coordination.
In cerebral palsy, there is a disrupted brain-to-muscle communication, which changes body reflexes, muscle tone.
All can be affected in cerebral palsy. So when the brain control of muscles is disrupted.
Cerebral palsy occurs when motor control areas of the brain are damaged, disrupting how signals travel through nerves to the muscles.
When motor control is disrupted, muscles may become too tight, or called spasticity fart, or too loose and weak, known as hypotonia. As children with cerebral palsy grow, their muscles can change, becoming tighter, weaker, or harder to control with age.
We can see the non-progressive nature of the injury. Cerebral palsy can happen when something affects the baby's brain before birth, during birth, or shortly after birth.
If the mother gets certain infections during pregnancy, like those in the torch group, the germs can cross the placenta.
If the baby's brain doesn't get enough oxygen during birth, it can damage the developing nerve cells, affecting movement, posture, and coordination.
When the placenta fails to deliver enough oxygen, the fetal brain dies. This is what we call hypoxic brain injury.
Cerebral palsy can also result from premature birth, bleeding, severe jaundice, infections, or head.
Cerebral palsy can happen when something affects a baby's brain before birth, during delivery, or shortly after birth. This means brain injury can occur at any stage of early life, in the womb, during birth, or soon after. If a pregnant mother gets certain infections like toxoplasmosis, rubella, cytomegalovirus, or herpes, these germs can cross the placenta and damage the developing brain. Sometimes, genetic problems or brain malformations occur, meaning parts of the brain form abnormally. And if oxygen supply to the fetus is reduced, a condition called hypoxia, brain cells may be permanently damaged. During birth, asphyxia can occur when the baby doesn't get enough oxygen. For example, if labor is too long or the umbilical cord wraps around the neck. Premature babies are especially vulnerable. Their fragile brain tissue may be damaged, causing periventricular leukomalacia, a major cause of cerebral palsy in preterm infants. Also, bleeding inside the newborn brain, called intracranial hemorrhage, can destroy brain tissue and impair movement control. After birth, severe neonatal jaundice can cause a toxic buildup of bilirubin, damaging areas of the brain that control movement, a condition known as kernicterus. Head injuries from accidents or falls can also harm the developing brain. And infections like meningitis or encephalitis can inflame and destroy brain cells, leading to lasting motor problems. In summary, cerebral palsy can result from any event that injures the developing brain, whether through infection, oxygen loss, premature birth, or trauma. Early prevention, safe delivery, and prompt treatment of infections can greatly reduce the risk and protect a child's brain health.